program for those with memory loss, Joe, and let me explain why. You have no devices. There's no bracelet, there's no necklace, nothing that you have to push in order to activate the system. So, you know, if excuse me, if someone that is not aware of what's going on, and they have fallen and can't or don't know how to get help, you know, they don't have to know how to do that. The sensors are there to help someone that can't call for help. And so,
how have you seen working with the Quiet Care? Mm-hmm. Can you give me an example that you felt, my God, thank God we have that Quiet Care system, that you can tell us, share a story with us that you said? Can you share something with us?
Actually, I do want to share a story, and it's not something that happened at our community, but it's something that happened at one of our other communities. There was a resident who had been getting ready, you know, to start her day in the morning, and you know, excuse me. Sorry.
So they were getting ready in the morning.
Yes, so this resident was getting ready in the morning. The staff had just been there, and you know, they were talking to her, and you know, she was, you know, doing her hair, and she was fine. They left her, and not even 5 minutes later, they got an alert that she was in need of help, and you know, they thought, wow, you know, we were just in there. What could, you know, what could
possibly happen?
What could have happened? And when they went back in there, she was choking on something, and she, of course, she was safely helped, and you know, nothing more happened. But had they not had the program, the Quiet Care, then they might have not come back to see her for another hour.
Can the system, Aurora, detect somebody if they have fallen?
Yes.
It can.
Mm-hmm.
Okay.
It's really high tech, Joe. It will even let us know if the apartment is too hot or too cold for someone. Oh. And so then the staff can come in.
Especially with seniors. That, you know, that is something that their skin is very sensitive, and that's interesting.
You don't want someone to go into dehydration, or you know, again, speaking of those that have memory loss, if they're touching that control, you know, and they don't realize how hot it is, you know, that this is a good way to make sure that...
This is a very high-tech system.
Exactly.
Aurora, how is the care personalized?
Well, of course, we have our nurse that completes the assessment and determines what that person's needs are, and how we can meet them. And so having the Quiet Care especially has made a big difference, because we can, like I said, what is normal to one person is not going to be normal for the next. And that the fact that we can make sure that that person can continue to live their life just like they did at home, except in those times that they need help, that we can be there for them. You know, that's a good way to personalize their care.
Does Royal Estate offer any other programs? And I'm going to just looking at when I've walked into Royal Estates, the activities that are going on, and it's a very holistic type of community. You're doing a lot of spiritual. I've seen some Bible classes going on sometimes. I've seen some nutrition classes and exercise. What other programs do you have, Aurora?
Well, we have our program that is called Wellness Every Day. All that means, Joe, is that we're going to use the 6 dimensions of wellness. You know, the physical, intellectual, emotional, spiritual, social, and vocational.
So it's very holistic.
I mean, it's a way to make sure that there's always something for everyone. You know, that you can look at that calendar and say, there is actually something that I do enjoy doing, and it's on this calendar, instead of just having something in general for everyone. You know, that is the best way to make sure that there's always something available for.
Do you find your residents participating in your programs?
Definitely, Joe. We have lots of great programs, and in fact, we advertise monthly, and we invite the public to participate as well, and to experience some of these events that we have. Because we understand that it's important not only for our residents, but that we are able to help nurture
the seniors in our community.
The seniors in the community in
I'm
general.
glad that you're saying that, Aurora, because and that you're opening it to the community seniors,
Right.
and because there's not a lot of things in our community for seniors to do, and I think I would strongly suggest that you go out there and to these communities, Royal Estates, and look at their events calendar and try to see and participate in them, because I have seen some good topics, and I've seen you bring also guest speakers to your community to talk to them, and again, you want to invite the public to these services and programs. Why is it important to offer these programs to them?
Joe, a lot of people think that because they are seniors, they're just in the way, that they're taking time away from their children who are busy and who are living their own lives. And it's not so. I don't believe their children feel that way. But it's important that they're in a community where everything is done just for them, to make sure that their lifestyle is what they need, and not trying to fit into anybody's life, especially with, the grandchildren and children who are, coming in and out of the house, and sometimes, especially in our culture, we think that we're going to have mom or grandma stay at our house forever and ever, just because we would never want them to feel like they're not wanted, and or that they're in the way. But once they have visited the community, they understand that more than anything, it's a gift, because sometimes initially there's guilt, and once they realize that it's not in any way a way to abandon their loved one, that it's more of a way to help them, have that independence back
and thrive.
And exactly. And so, that is so important to us. And that's why it's so important to have all these programs that will help them to stay healthy, to be as independent as possible, to be active, to socialize and do all the things they once did. There's no reason for them to have to stop.
Aurora, you have a strong passion for what you do.
I do.
And your executive director is
Isabel
Rodriguez. And I know also Isabel, and I've always have admired, and she has a lot of knowledge, but you do have a lot of compassion.
Yes.
Why do you work with the senior community?
Joe, it's that feeling of wanting to help, and
do you love what you do?
I love what I do.
Why?
It's a way to, for me at least, to go home and at night, thank God that I was able to help someone. And whether it's a resident of ours or it's a family who feels very upset and that was able to see me have the tour and leave there feeling better about their decisions.
Their decision, and they're going to be in good hands. If a family member wants to talk to you about their services, about your services at Royal Estates, do you welcome them? What is your best advice if a person I don't know anything about assisted living, I want to know more about independent, I'm naive, I'm going to ask you some questions. What is your advice to somebody that is seeking into moving into one of these type of communities? That you give, that you want to share with the public?
I think that it's very important that they visit the different communities in El Paso. We certainly have great communities in El Paso, and to me, Joe, I love our community. I'm very passionate about the programs that we offer, because if we didn't have them, I'm sure that there would still be residents that would be very happy there. But the fact that we have them make their lifestyles even nicer. And so, but I also believe that we're not the community that is right for everyone, So definitely look at all your options, ask all the questions, and and make sure that you visit a community that you like, whether it's 2 or 3 options, that you visit them more than once, and
tour
visiting the community is very important, yes, because sometimes when we get a phone call, I really love to be able to answer all of your questions and be there for you in the sense that if you want to schedule something, I can do that, but definitely visit the community, because that is the only way you get a good feel for what the community does.
And you know what, Aurora, something that you just said right there, look at your other options, visit other communities and compare. And once you go to another community and they see your community, and they're able to see which community is going to best fit them. Some people live on the east side, and the family, the caregivers want them closer. Well, then that's understandable. But again, I do think so. Do you think there is a process that I'm sure not everybody wants to move? Oh, I want to move, and you have a waiting list. Do you see that for the most part it is a process that families are not, or the resident is not ready for the community? Do you find that?
It's mostly fear, Joe. It's mostly fear of the unknown, and feeling like, again, those guilty feelings of I'm abandoning someone that I love. And
do you just feel that once they're getting there, that getting that first step in the community, looking around the community, you taking them on the tour and sitting down with them, that they're more at ease, the family and the resident?
Yes, definitely. Because then a lot of times, even in speaking to the professionals out there, in the healthcare, no matter how much I explain at times what we provide, what services we provide, and what we are, I still see that. I always say I almost see that little bubble above their head, and with the image of a nursing home. And I think that when people are calling to find out information about assisted living, that's what they're envisioning. And so once they come to the community and they realize that, to me, it looks like a hotel. It's a beautiful community, and so I think just by looking at it initially, you'll start to feel a little bit better about just being there.
Aurora, thank you so much for being on our program. Again, what is your number that they can contact you at?
You may reach us at 915-833-3332. You can ask for me, and I'd be glad to give you a tour. But anyone in general can help you. It doesn't have to be Monday through Friday. You can visit our community 7 days a week.
And ask for Aurora Carrillo, the Marketing Director of Sales for Royal Estates.
Yes, sir.
Aurora, thank you very much for being on our program.
Thank you,
for
Joe.
sharing this information. It was very informative, and I appreciate you being here.
And I thank you for giving me that opportunity.
God bless you.
You too. Thank you, Joe.
Thank you, everyone, for joining us today for Choices to Benefit the Aging. If you have any questions about senior services and programs in our community, you may call me, Joe Urrutia, at 588-8382, or you may call Robert Vasquez, Community Senior Service Coordinator for Choice Home Health and Hospice, also about any community service benefits for you in our community. His number is 630-7185. Thank you for joining us today at Choices to Benefit the Aging, and God bless you.
Choices to Benefit the Aging has been brought to you by Choice Home Care and Hospice. For more information on this program, go to El Paso Southwest Senior Magazine at www.southwestsenior.com. Furniture provided by Copenhagen, 6550 North Mesa.